Okay, welcome to those of you who are just joining us online. You're welcome, and we hope you're ready for this global workshop. We're waiting for Lisa Menning from the World Health Organization to arrive, and Charlotte Mbou and François Gass, who have been leading daily sessions throughout the Peer Hub exercise. We're focusing on vaccine hesitancy. So if someone has sent you this link or you're not familiar with the Peer Hub, we'll be starting in just under 8 minutes. You can find more information. Let me actually go to the page, and this should make it easier to understand what is the COVID-19 Peer Hub. The Peer Hub was created in July 2020 to share experience, spread the good ideas, and take action to keep vaccination going during the pandemic. Applications to the Peer Hub are closed now. There's over 6,000 people who have been accepted into the Peer Hub, so immunization staff working at all levels across 90 countries. The Peer Hub is really about giving and receiving support. Now, in recent, since the 9th of November, we have been focused on reviewing how immunization staff have moved from vaccine hesitancy to acceptance. So if you're just joining us, we're starting in just over 6 minutes. You're not late. We've announced this for 12:30 Geneva, so that's in just under 7 minutes. And you're very welcome to join and watch. And we'll be looking at your comments as well. So we will be sharing the comments online. In fact, our very first comment comes from Rizwana Enayat. So hello and welcome, Rizwana. We'll be starting in 6 minutes. We'll go back to the music, and then I'll pop in so people who are just joining the stream can understand what is going on. And so today you'll be listening to draft case studies presented by members of the COVID-19 Peer Hub, and the case studies are about how each author of the case study was able to move an individual or group from being hesitant, reluctant, or fearing vaccines to actually accepting the vaccines that they needed. And of course, this is especially relevant because of the coming COVID-19 vaccine introduction. So we'll see you in a few minutes, and we'll have a lot more to say on this topic, obviously. I'll see you soon. This event is about moving from vaccine hesitancy to acceptance. We'll be getting started in a few minutes, and we are live streaming today's event across LinkedIn, YouTube, Twitter, and Facebook. So you should be able, whichever platform you are using to watch, you are very welcome to the COVID-19 Peer Hub, so a group of more than 6,000 health professionals who've been working together since July 2020 to share experience, spread ideas, and take action to keep vaccination going during the pandemic. Applications are closed, but you're welcome to watch and listen to today's event, in which participants, members of the Peer Hub, are going to be presenting their case studies specifically on how they were able to move individuals or groups. For those of you who are just joining us, a warm welcome. So we'll be starting in less than minutes. Actually, we're going to shift gears, and we'll be introducing the COVID-19 Peer Hub. So yes, great to see people joining from Facebook, YouTube, LinkedIn, Twitter. You're able to watch us on all these platforms. See you soon. Warm welcome from Geneva, Switzerland. This is Reda Sadki of the Geneva Learning Foundation. We're meeting today under the umbrella, the global tent of the COVID-19 Peer Hub. With me in the room are over 30 members of the COVID-19 Peer Hub who have been working on case studies documenting instances of vaccine hesitancy and how they, as immunization staff working at the country or subnational level, have been able to challenge successfully, move individuals or groups from hesitancy to acceptance. Of course, this is extremely relevant given the current situation, and that Gavi, the Vaccine Alliance, has announced that in 2021, immunization staff, such as those in the room with me, will be asked by their ministries of health to help deliver over 2 billion doses of COVID-19 vaccine to protect population from the coronavirus. Welcome, and hello to Charlotte. Charlotte, how are you doing today?
Hi, Reda. Hi, everyone. I'm doing just great. And it's always a pleasure to have the opportunity to gather as a community, as a peer hub, to listen to fascinating stories from scholars, especially when they're talking about vaccine hesitancy, situations in which they had to get people to change like camps, to move from a position of hesitancy to that of acceptance of immunization services. So I just want to say a warm welcome and looking forward to hearing the stories that will be shared here today. Reda?
I just want to thank all of those of you who are joining us across the platforms where we are live streaming this workshop. Why live stream this? It's really to involve people who are not members of the Peer Hub. Applications are currently closed, and we want to make sure that you're able to learn with us and join and contribute. So we'll be looking at your messages, whether you're watching on LinkedIn, YouTube, Twitter, or Facebook. And in fact, we have some of the first messages coming in already. So I'm going to show these just to, first of all, we had Rizwana, who was amongst the first to join us. Rizwana, welcome to this workshop. Who also likes the music that we were sharing before we got started. Now, hi Dar. I'm not sure how to read your name with the umlaut and the accent, but you say good PM, good afternoon, with all the scholars all over the world. Now, Dr. Tanushri Mandal from West Bengal, India, very excited to be here. And Ahmed Navit, hi everyone on Facebook. Mercy Reception is connecting from LinkedIn. Greetings to everyone watching from Nigeria. So Mercy, warm welcome to you and scholars from Nigeria, India, and everywhere else. Please, if you leave us a comment on whether it's on LinkedIn, YouTube, Twitter, or Facebook, we're keeping an eye on all your comments, and we'll be, in fact, sharing them on screen. And please tell us what city, as well as the country you are connecting from, if you feel comfortable doing so. Halima Toro from Nigeria, welcome, Halima. All right, let's get down to business, and we're going to ask a first member of the Peer Hub to present their case study. So just to give you a little bit of background, let me find the question set, in fact. Here is what members of the Peer Hub have been working on. So it's actually a more detailed assignment, but these are the overall questions. What was the situation? And it's when you convinced someone, an individual or a group, to vaccinate children who needed that vaccination. Was it before, during the pandemic? Who was involved? What was your role or responsibility? What specific actions did you consider? What actions did you take? And we're especially interested in the words you used to convince vaccine hesitant individual or group. How did it turn out? Who or what helped you? Was there anything that surprised you? So these are the things we're interested in. I'm going to go now to Charlotte to get us started and invite the first speaker to present.
Okay, thank you very much, Reda. And I just want to take this opportunity to also to greet all of the scholars of the Peer Hub that are with us here in the Zoom room. We are seeing your greetings on the chat. So greetings to Patricia Udowu Collins, connecting from Nigeria. Says she's super excited to be here today. We are super excited to have you with us. We have Umar Traore, that's a bilingual scholar. He's from Guinea Conakry. Abdilatif from Somalia. So it's a great joy to have you with us. And, we are here in Zoom room, so it will, you all have the possibility of unmuting yourself. But for the sake of order, we will want that if you want to speak, we'll want you to raise your hand, and it will be a pleasure for us to invite you to unmute yourself and take the floor. So now, before we even started the session, some scholars already contacted me that they wanted to share their case studies. So I'm going to go in order as they had requested. So I'm going to start with Dr. Tanushri Mondal, that's joining from West Bengal in India. Tanushri, please, can you go ahead and unmute yourself?
All right, let's hear a round of applause to welcome our first speaker. And we look forward, Tanushri Mondal, to hearing your story. Charlotte, if you could mute your microphone, and Tanushree, please get ready to present. Yes, and I realize the music is quite loud. Tanushree, will please go ahead and unmute, and you are our first presenter.
Thank you very much, Dr. Reda, Charlotte, for giving me this opportunity to share my story. Yes, so what was the situation like? Actually, it was a case of, vaccine hesitancy in the community. I would just tell that it was in the year 2010-11 when India was, harboring half of the polio cases in the world. And at that time, there was a great drive to, eradicate or rather eliminate polio from India. Now, what happened is that there were government institutions as well as the partner organizations working for the elimination of polio. But in spite of the routine immunization as well as the SIAs as well as house-to-house visits, there were certain communities who were very resistant, for this accepting this polio vaccine. They were very resistant in giving their children this vaccine because they thought that, in spite of the knowledge they were having, they thought that it was a kind of a conspiracy. Now, where did this idea came in? It was unknown, but yes, there were certain events occurring all around India where there were cases of this AEFI, the adverse events following immunization, and this community became very sensitive to it. Now, what happened is that there were cases where the immunization team went into the community and they were locked down in the immunization room. So it was a very difficult and tricky situation. So the government they helped hand in hand with the partner organizations as well as the faculties and the public health organizations, and they wanted to bring a change. So what they did is they brainstormed, and we brainstormed on how we can overcome this situation. So it was not a single person, but it was a community involved. So, there were feelings, there were sentiments, there were religious sentiments, and it was very hard to crack. Now, what we did is that we applied the SWOT analysis. At the brainstorming session, we sat together and we tried to find out what were the strengths, the weaknesses, the opportunities, and the threats that we were faced. What happened is we found that there were certain strategies that we had applied, but in spite of that, things were not running. It was not IEC that was important, but it was a behavior change communication. We wanted to bring that change in the behavior. So we went into, we had applied, the strategy that if our first line of activity fails, then we will go to the second line of activity. And if our second line of activity fails, then we will move on to the third line of activity. So we were prepared for everything. Now, what we did is that we applied another strategy, another business model that is called the PESTEL model. It is in fact, taking into analysis the political situation, the economic situation, the social, technological, legal, as well as the environmental situation. And we were taking into that thing. And what we found is that we targeted those groups, or we targeted those houses which were very influential. That means if we can make a change in that house, then we will be able to make a change in the community. So we approached the head of the family, who was a religious leader, but he was very staunch in against giving this poliomyelitis vaccine. So his grandparents, they were denied giving this vaccine. So what happened? Yes, as many case studies we find that the women in the house, they were much more acceptable. They tried to accept this idea rather than the male person in the house. So there was a gender difference in the opinion in the household itself. Now what we did is that we first approached them. We also when we found that things were not running properly, we went into some in-depth interviews in the community. So this was held by the CBOs, the NGOs who were working along with us. At the same time, what we did is we brought the like-minded people and we organized the focus group discussion to try to find out that what was the basic problem, what were they thinking alike. As a result of which, it was a long drawn process. And it was not in a day. It took around maybe 2 months, 3 months in a time. And the stakeholders that were involved into these activities were everyone: the government, the private organizations, the partner organizations, and what we find is the specific actions that we did is we talked with the political leaders, the community leaders, the mass media, the religious leaders, and this religious leader was, he was very staunch. So we took the help of another religious leader in another portion of the block, and we took him into confidence so that he can motivate this very person. Also, we took another strategy. That is, we were very lucky enough that we got a case of poliomyelitis in the community itself, and that was in fact an eye opener for this particular family, because this child who was suffering from polio, this was not only a problem to the child, but it was also a problem to the community as well as the family. So this family helped us in bringing a change in the thought process of this very particular family we took into account. And once this family was convinced, then since he was the religious leader, so all the other families of that particular community and that particular place followed him. So this way we could bring a change into it. And further, I would say that yes, it surprised me because we were not very hopeful in the first go, because things were not running according to what we wished for. But one thing that I would recommend or suggest is that any problem, it has a solution. So there is no problem on earth that has no solution. So every problem has got a solution, and it is main that we don't lose hope and our objective. That is what I wanted to say. Thank you very much.
Thank you so much, Tanushree. So I'm going to ask Charlotte, who has listened to this case study, if Charlotte, next week, participants, members of the Peer Hub, will be peer reviewing case studies. So if you were reviewing Tanushree, the written version of the case study that Tanushree just presented, what questions or comments or feedback would you give her? Could you give us a couple of examples of the kinds of comments you would make where you would want to know more, or where, on the contrary, you think it should be more concise? What exactly would be of greatest interest to you, and how could you give her constructive feedback to help her improve her case study, Charlotte?
Okay, thank you very much, Reda. So I want to first of all thank Tanushree for her story, quite interesting and very much detailed. But if I were a reviewer, I would want to find out, it's all about the words that make a difference. It's all about the words that make a difference. I want to find out more. What were the words that were used specifically in specific situations and occasions towards particular audience that were used to get them to convince them to accept? I know, yes, she mentioned the case of the child. They had a polio case already in the community, and they were saying that's the problem. But how were the words put across? And also, that was a case she said it was polio. There are some certain issues, maybe more structured. I wanted to say, okay, this was the situation. We had the communities. These were the particular reasons they were giving, because I didn't really get that put forward. Why were they against the polio vaccine? Clearly point by point, and how each of these was addressed by them. So basically, and Reda, you're getting me to play a Francois' role, but I know Francois is also in the room with us, and he usually has some very specific and pointy questions that he addresses to the scholars.
So actually, Lisa Menning has from the World Health Organization has just been able to join now. So unfortunately, she did not hear Tanushree's case study. I propose, Charlotte, that we will give additional feedback to Tanushree, but that we proceed to the next presenter. And this time, thank you, Lisa. I'm so glad you were able to connect. I know you may have had some challenges, but glad that you're with us. And Charlotte, if you could introduce our next case study author.
Okay, thank you, Reda, and welcome, Lisa. So it's going to be Ngujobi Anifat Omowumi from Nigeria. So yeah, she on the panel. She's like in Phoenix Hot 8. But I just want to invite to unmute. Please, you can unmute yourself, and then you share your story.
And you should be able to rename her as well. Yeah.
Hello. Hello.
Hi. Hi.
Hello. Good morning, good afternoon, good evening, depending on where you are calling, you are hearing me. So my name is Hanifa Ategujobi Omowumi. I'm from Oyo State, Nigeria. The story was about a family that hesitated to immunize their newly born baby. I was being informed in my community that the family were reluctant to take the newly born baby to the hospital because of wrong impression they have about the vaccine. They thought that there is availability, thought that there is availability of COVID-19 vaccine in the country, and they believe that the government aim is to use the vaccine to depopulate the country population, or the vaccine might have negative effect on their child if given the vaccine. I was informed by them during our conversation that there is nothing called coronavirus. They have the thought that there is nothing called coronavirus, that they call the disease advanced fever, that the government just want to seize the opportunity to get grant from the World Bank. This particular family have lost their trust in the government. They believe that government cannot do them any good things without having any hidden agenda. I tried my best to enlighten them about the importance of vaccine on the children, especially the neonates. I educate them about the coronavirus that is affecting the whole world now and claiming a lot of lives, especially people with underlying diseases. I also reorientate them on the wrong impression they have for vaccine. They were also enlightened that serious work is ongoing on the coronavirus vaccine, and if it is available in our country, Nigeria, they should make sure they are all vaccinated. That is, they should embrace the vaccine. I also educate them on the efforts world leaders is having in order to save life of people. I try my best to persuade these people on their wrong impression on vaccine. I even call the religion leader and the community leader in my area, in my community, to speak with them. And at the end of the day, I give glory to Almighty God because they finally danced to my tune and made sure I drove them to the nearby government hospital where their child was finally vaccinated. In fact, I was at the end happy that all the knowledge obtained during the pandemic were not wasteful. So thank you.
Thank you. Thank you, Anifat. So we're now going to turn to Lisa Menning from the World Health Organization. Lisa, welcome. Okay. There's two parts to the feedback and that we're looking for from you. One is, what questions or additional comments, what else would you like to know to flesh out the case study so you understand the situation, what happened, how it turned out, and so on? And second, what would be your feedback in terms of guidance, pointing Anifat to resources or that would be useful to her in reflecting on the situation and in preparing for the next time she's confronted with something like this?
Yeah. So, Anifa, thanks so much for sharing this with us. There's a number of components to what you've described. And firstly, thank you for just sharing this with us and all of your efforts to pursue this and really try to bring people to be vaccinated. So what I would say,
thank you,
there's a little bit that would be helpful to better understand around the connection and of the religious leaders and the influence of the religious leaders, and how much they are in support of vaccination. So I think there's, and I would also think about, like, who are the other influential champions of vaccination in this community or elsewhere who you can be working with. And I think it's about, in such situations, building a little circle of support for vaccination, so you don't feel like you're alone in this work, and that you have others, whether they're other religious leaders or other local authorities or local people who are well known, who are really well respected, like maybe even a local pop star who's really, performs a lot at the local, bar or something. And, build this little circle of supporters for vaccination and work with them to just promote the importance of vaccination. And so there's two things. There's the groups that you need to be working with in building this support for vaccination. And the second is about the words that you use, the content, that your messaging, how you explain the importance of vaccination. And what's important is to be understanding truly why people have certain kinds of concerns. And there can be so many different reasons why people are not fully convinced about vaccination. Maybe it's just because they had a bad experience last time they were at the health centre, or maybe they did hear some rumours, through WhatsApp or some chat. So it's really important to understand why and to be listening, because then when you're having these conversations with people, you're better able to really address the underlying issue and concerns that they have, and doing that in a really caring and kind and patient way. And I think that you're already doing a lot of that, but there's just a few things that I've described that might give you a little extra inspiration for these conversations that you have ahead. But yeah, thank you very much.
Thank you, Ma. You're welcome.
Thank you, Lisa and Anifat, for sharing this this case study. I'd like now to invite members of the Peer Hub who are in the room. If you have additional comments or would like to ask questions to Anifat, and think about this is what you will be doing next week. We'll be peer reviewing, so you'll be given 3 case studies, and you'll be asked to help your colleagues to improve, so to better explain their story and to better reflect on it. Thembi Mana, you seem to have, would you like to make a comment or respond? Do you have questions for Anifat, or would you like to comment further? You are live. And you will need to, Thembi, you will need to unmute yourself. All right. Let me see if I can.
Okay.
Yes.
Yes, thank you. Yeah, I'm putting on my mask because I'm at work. I struggled so much because I was pushing so hard just to attend the Zoom meetings. So I was pushing so hard to attend this one because I've just started roughly my assignment. Then I was hoping that at least I can get some more info just to submit it tonight. This evening, not tonight, because I'll be late actually. Thank you.
All right, Thembi, I'm so glad you made it to the meeting, to this workshop. Would you be ready to at least tell your story, even if you haven't written down your case study? To just
Yes.
Yes.
So, okay, it was just before, at the time, during the time of COVID. So I'm in South Africa, so everything was closed down, but the local clinics were open. It was one of my nephew. So the mother was so very uncomfortable to go to the clinic. I advised her, talking to her, advising her around the disadvantage of the child not having the immunization. But even the husband was very so skeptical. They didn't want to do the immunization. But I managed to convince them, because I just opened a private practice, a healthcare center. So I managed to ask the sister so that they can go where there's no lot of people in my clinic. So she was eventually successfully immunized. So even now she's up to date with the immunization. So I thank so much that I'm just taking high five on my side, because I managed to convince both parents so that the child can be immunized.
Thank you, Thembi Mana. I'm going to turn first to Charlotte. Charlotte, could you give Thembi Mana 2 or 3 questions to follow up to get to better understand her story.
Yes.
Yes. Okay. Thank you, Reda, and thank you, Tembi. It's great to see you. All right. So
Thank
I
you.
have my first question is before COVID, will the parents have accepted to get the child immunized? Because I want to get the reason for their hesitancy more clearly.
Please come again, sir.
So I asked you, okay, what did the parents give as reason for the hesitancy? And what were the words that you used?
Okay.
Yes.
Okay, thank you. Oh, thank you. The hesitancy for the vaccination, it was the healthcare workers were sick in our area, were very sick with COVID-19. So they were like so afraid of their child is gonna get sick as well.
Okay, and so what specific words, you said you were able to convince them. So what were the words that you used to get them to change their minds and come to your clinic?
Okay, you know what? Because in South Africa, we are very much aware of the immunization and everything. Even the parents, we don't have that thing. It's cultural. You cannot go for immunization. So I just told them that, you know what? It's gonna delay the growing of your child. You know, the child can have difficulty in walking. The child can have difficulty even in the vision because the child has just lost the immunization.
Okay, thank you.
Thank you.
Thank you.
Thank you, Charlotte. Let's now go to Lisa Menning. Lisa, if you have follow-up questions to clarify, to better understand the case study, or if you'd like to already share your feedback and your thoughts with Thembimana, that would be much appreciated.
Yeah. And thank you so much for sharing this. And again, all of these persistent, enthusiastic efforts to, convince people to accept vaccination. So I can see that in the way you're responding to this person, you're trying to explain to them the risks of not vaccinating their children. And that is definitely the right strategy. But I would also say that in doing that, try to not exaggerate those risks. And I can see absolutely your frustration and clearly you know the importance of vaccination and you really want the best for them, of course, right? But, it's really what happens if you're actually over enthusiastic and if you're over forceful, it can actually make people less likely to change their mind, okay? There's this reluctance that happens, which actually makes them hold on to their views even more strongly because people don't want to be told that they're wrong, right? And sometimes they have certain underlying beliefs that are really part of why they are not sure about vaccines, certain values or certain morals, right? So you're definitely doing the right thing in explaining to them the risks, but I would keep it really more 2 things. One is explaining the risks of measles, the disease risk. Measles, as you said, like some of the consequences are these disabilities, right? Or long-term health conditions. But I think that I would say do a little refresher on what are the consequences of measles and these other preventable diseases to make sure you're just sticking with the facts. And the other thing is that try as difficult as it is, try to resist this reflex to correct people. Now, I know that's really, really difficult because when you hear someone saying something that you know is wrong, right? It's really hard not to say, no, like you're wrong. This is correct. This is what's supported by science. But it actually requires a conversation that doesn't directly challenge what people believe, but starts by listening and then working around those issues. They're these conversational tactics, and actually share more with Reda about these conversation strategies that he could share with this network to assist you all in how to have these conversations. And that might be helpful in enabling you to kind of understand, I think you're absolutely on the right track. You're doing the right things, but it's just bringing a little more nuance to the way that you approach it. Okay? But well done. And thank you for all of these important efforts.
Thank you so much, Lisa, for this feedback. So we are at the halfway mark for the workshop. A reminder, Thembi Mana, the most important part is that you put down on paper. This is sort of step one. Tell us your story in writing. And then, as you know, there's a second part to the case study where we ask you to reflect on it. What would you do differently? And perhaps there you can take into account, take note of Lisa Menning's feedback, in terms of how to keep striving to do better as you are already doing. So let's mark a pause with a round of applause, and let's come back for the second part of this workshop. We will keep going. We'll hear more stories, more case studies, and we have with us both Lisa Menning for the World Health Organization, also François Gast, who has been working really side by side with scholars from all over the world, as Lisa is doing with us today, and we're very happy that she's able to make time for this as the global partners are getting ready for what is likely to be a quite sizable let's say, vaccine introduction and rollout challenge, where vaccine hesitancy, community engagement, demand promotion are likely to be front and center. So back to you, Charlotte. Who will be our next presenter?
Okay, thank you, Reda. Rosina Mistry, she expressed the desire to share her story and receive feedback from Lisa today. So I'm going to invite Rosina. Rosina, if you can just unmute yourself, you have the floor.
All right, I'm asking Rosina to unmute. Yes, here we go.
Thank you so much, Charlotte and Francois and all others. My story is basically something that happened to me very recently. And as I've written in my story, because it was so recent, I could actually remember the conversation that we had. And this was a driver who was driving the car, and I had gone to this very high level, university for a board meeting. And while I was returning, I saw all these posters on the wall inviting students and staff, faculty, and others to participate in the COVID vaccine trial, which is a Chinese vaccine. And so I just saw it, and it was on my mind. So as I sat in the car, I asked the driver, I said, have you taken this vaccine? And from there, the conversation started. So he said, no, I have not taken it. And then he said to me that, they are offering, I will just give you the gist. All the details are in my case study. So he just said to me that all because they are offering some money, some people are just lured by it and they want this money. So they are taking this vaccine not knowing that this may have some harmful effect. I was quite surprised with the fact that somebody who is a driver, and probably in all my sort of, assumption, he would probably not know so much, was actually quite well informed about, the trial and, the fact that it has some, side effects that we might not know about. So from there, the conversation is started. And then, we had this whole discussion. And then as I was talking to him, I wanted to really focus on what is important to him. And I know that, this vaccine is, I even don't know the side effects of it properly. So I didn't want to overemphasize upon it, but I just focused on giving him the facts that this is the vaccine. And his question was, why are other staff not taking it? And I said, you wouldn't know because they might be asking the vaccinators to come to their office, but I don't know. And then he said that, well, why are they giving us the money when usually they charge us for the vaccination? And I said to him, well, just because what you just said, that it's in trial. So, it takes effort for you to come now and then after 2 months. And they want to record all your experiences. And so, it was like a 45-minute journey from where I was coming and when I reached my home. But in that period, I mean, after a few minutes, he would keep quiet and then he would ask me another question. And then I kept on answering him. I told him what the clinical trials, how does it take place, etc. So he was listening to it very clearly. And then I asked him, he said, but what if there are side effects? Then I used my behavioral science approach. I said, okay, do you know anybody who has taken the vaccine? And he said, yes. So I said, do they have any side effects? Are they coming to the work? And he said, yes. And I said, did they have any side effects? So he said, well, one of them had fever and chills, but he's okay. He's back to work. So I said, so do you think that this vaccine is so dangerous? So he says, well, I guess not. And then I asked him, I said, did you get your children vaccinated for EPI? And he said, yes. I said, from where did you get these children, your children vaccinated? He said, and he was very generally, because he's a driver of this very well-known university. So he said, probably from this university. So I said, okay. And did your children get any side effect because of that vaccine, EPI vaccine? And he said, yeah, fever, and pain. And then we gave him the medicine that was given from the hospital. It was Panadol. So I said, so why did you come to this hospital? Because it's a good hospital, he said. They have good system here. So I said, and do you think that this hospital would take the risk of actually giving vaccine, which is still has probably, in your view, so many side effects? I mean, do you think that they would even take that chance, knowing that, they can easily be sued and whatever not? And then he kept quiet. And this was actually the hitting point. And then he said, you are right, they will not do that. And I didn't tell him to go and for not to go for it. But then he himself said, well, maybe I would also go for it. So I said, okay, it's your choice. You decide. But I'm just telling you, like, what is this and what is happening behind the scene, and so that you know about it. So, and that's when I got down, actually. So all I'm saying is that basically the lesson learned, and I mean, I have worked in this field for a very long time, not just in immunization, but also in family planning, which is a difficult topic, skilled but delivery. So, I mean, I've been using all these models and I teach also and everything, but I was happy. But then when I reflected after, like writing this case study, I was thinking, I didn't tell him that this is a double-blind, approach that they are taking, and that only 50% of the participants would actually be getting the vaccine and rest will not be getting the vaccine. So that in case anybody actually develops, God forbid, COVID-19 infection, then, he shouldn't think that the vaccine is ineffective, but that there is a chance. But I didn't tell him that. This was after, hindsight, I'm thinking that maybe this is what I would do. But basically, I mean, there are lots of such, models that I've used in my life, going from positive deviant to, other things. But in this was particular one in which actually focus was on giving correct information, listening to his concern. I just kept quiet every time he asked a question, and then I answered him. And then he kept on driving, and then he asked me another question. I again answered him. So it was a relaxed visit, so we had enough time also probably. And so this is what happened. So I just thought I would share this study. Thank you.
Thank you, Rosina Mistry. We're now going to go to Lisa Menning for her comments, response, feedback, guidance. Lisa?
Yeah, thank you so much for sharing this and for recounting the different parts of your conversation. I mean, I don't have any, strong recommendations that come to mind in hearing this. And, that I don't have anything new that I would add, given what I've already outlined just in this session so far today. So, but what I would ask is, like, do you have a specific part of that story where you felt you were struggling the most, or where you're really not sure about what kind of action to take? So where do you feel that you had the most difficulty in that encounter that you described?
Yes, thank you, Lisa. I think the most problematic part was when he said, why are they giving the money? Generally, they charge. Why are they giving the money? And I mean, it was sort of a, in a in a way that, there is a hidden agenda. I mean, he was trying to insinuate that there is a hidden agenda, because this university actually is known for its very high price services. And so he was quite surprised that actually instead of charging, they were giving the money. But then when I told him that, look, if you are given 3,000 rupees at this point in time, and if they want to give you a second dose, when they will probably give you some more money, although it is after 6 months, so it will be the last tranche, it will be after 6 months. I said, then how would they ensure that you come when you know that you owe somebody some money, right? So I said that probably you will go and they will ask you, have you had any side effects, etc. And then they will give you the second dose. And finally, they will again call you after 6 months, total 6 months from the first dose. And then they will ask you again. At that time, they will give you the, your whatever due is left. Otherwise, why would anybody want to come back? They may simply go away, and that would be such a waste of resource. So you just listen to it. And but as I said in my recommendation in previously when I was in the lightning session, I said that my recommendation is that even when this vaccine comes, I know we are very desperate to get everybody vaccinated, etc. But, I mean, every culture is different, every context is different. So in this case, probably I would recommend that, if we could twin it, couple it with some other initiative, like I said, that maybe those who are getting social protection package during this period, if they could be asked to make sure that, bring the social, support package, so that, they see, okay, fine, so this is one of the benefits that I'm getting of it. Or for some other reason, like, so other things that, probably Vasila, we have a program called Vasila Rozgar, in Benazir Income Support Program, and they have a card, so we ask them to bring that. And that way we actually make sure that they understand that this is a privilege that they are getting. And somehow we get everybody, I mean, we find a reason to vaccinate everybody. I mean, there are a lot of in rural areas, in the outskirts.
Rosina, I'm going to have to stop you here.
Okay, no problem.
Perhaps ask Lisa if she wants to respond to any specific parts of those comments, because we have many other authors who have worked hard on their case study and who'd like Lisa to listen to their stories as well. Thank you. Lisa?
So I would have one just quick suggestion, which is, and this kind of might apply to everyone, which is like, before you're faced with someone who is hesitant, before you're faced with their reticence and their concerns or their questions, find a moment to prepare and think about the community where you work and the kinds of challenges that you're faced with, and write down a few notes and a few points and some messages that would help you be really well prepared with a response to these kinds of complicated questions that will come up. So if you can kind of, sit down and think, okay, in this community, I mean, maybe this is totally obvious, maybe you've already done this, but it sounds like with these questions that had come up about the financing and the underlying interests and those motives that are maybe profit-oriented, maybe those are things that are kind of well-known and that could be anticipated. Or maybe, sometimes people are working in a situation that's changing and evolving, and there's new developments because there's a new political party, or there's a new religious leader who's arrived somewhere, or there's a news item about vaccines and a certain kind of event. So always take the moment and think, okay, if someone comes in who has these concerns, what would I say? How can I prepare? And I think just writing those notes for yourself and being prepared with those messaging and the statements and those responses will enable you to feel better prepared when you're faced with that situation. And you don't need to think on your feet as much. And that way you can also be a bit more strategic and thoughtful, and even start by asking questions and then going from there. So, and making sure that your response is really caring and empathetic and kind, that, you're really not trying to end up forcing them into accepting the vaccine. So all of this kind of preparation that you can be doing when you have a little quiet moment will also help make you feel more confident and equipped when you are faced with these questions that come up from parents or the community. Thank you.
Great, thank you to Lisa Menning and to our presenters. We have many more stories. It looks like there's already more than 300 case studies that have been submitted. The point is to describe what immunization staff have actually been doing, how they have moved people from hesitancy to acceptance in order to open up the kind of conversation we're having now with Lisa Menning from the World Health Organization about what it means and what is recommended. What does the evidence say? What does the science point to that can actually help immunization practitioners who are on the ground? So I'm going to turn back to Charlotte Mbou. Charlotte, we have time, I hope, at least for one more author of a case study, a member of the COVID-19 Peer Hub, to share with us their story.
Yes, Reda, I'm going to turn towards Jyoti Londe from India. Jyoti, if you can unmute yourself, you have the floor.
Hello, good evening, everybody. I'm Jyoti Londe from India. Actually, I'm on the way to the home, so it may be some disturbances due to the vehicles. I submitted my story yesterday only. My story is about communication skill. So all you know that our country has a very colors of caste, colors of categories, colors of religions. So there are the problems related to with the caste, with the religions, with the category, that people have their own cultural beliefs, social beliefs, and their own opinions regarding the immunization services and family planning services, or I must say towards the public health services. So the story is during the COVID only, in the month of June end or May end or beginning of June, when the lockdown is releasing slowly in India. There are some shepherds which are belongs to the nomadic tribes. They migrate statewide to graze their sheep. So due to lockdown, they are stuck in a problem, and they are reside in the campus around our hospital. So I'm very curious that the family, the parents are very young. They may get married in early ages, and they had three children. So I'm curious that what is the immunization status of the children and what is the family planning status. But I don't have any way. How do I go there and talk with them? But I found the way, and I went there. And when I start talking, and I went to the subject of the family planning, so they surprisingly look at me. So who am I and what I'm talking about? So I introduced them that I'm a healthcare worker in this hospital, and I just asked them about the immunization status of the children. So they firstly didn't open. They shy. They have had fear. But when I asked them, they told that the sufferings they are having, that they are moving around the state. So the situation or sufferings made their children strong enough. So they need not vaccination or immunization. The situation or environment make them healthy. But when I told them that their children may become physically strong or mentally strong, but it doesn't mean that they have protection from vaccine preventable diseases. So when I ask them, when they go to the public health facility where they had any services about health in the public health facility, so they had very bad experience in the public health facility. So they had fear that they are being scolded, that they are not carrying their immunization record cards, and they are too late when they are coming. It is not immunization day. So due to this fear, they are hesitate to brought their children in the health facility for the immunization. And though they have enough money, they didn't know where to go to go for the vaccination in the private hospital. So their children are not immunized fully. They had some immunization, and also they had fear that they don't have the immunization record card, and they don't remember which child had which vaccine at last time. So they had fear that if the vaccination, their child got the vaccination, overdose of the vaccination or immunization. So I asked them to go to the hospital, which is district hospital, which has daily immunization clinic, and I assured them that they are not being scolded for being late or not carrying the immunization record card. So they are not ready to go thereafter. I need to spend 2 to 3 days to convince them. Finally, they went in the hospital. Meanwhile, I asked the staff in the immunization clinic so behave friendly towards them. Assure them that they are not being scolded, and assure them that whenever or wherever in the India they go in the public health facility, they will got the services at free of cost, but they need to follow the timeline, that is the immunization clinic. So this is the story. Due to the communication skills and patience, I got success, but it is for the one family only. So if it is not achieve success, I may go to the ANM in the urban health center who's under this area is, and convince her that she planned to immunize these children. So if we look at the caste and religion, caste and categories in the India, these nomadic tribes are the tribes who migrate here and there, and it is impossible for them to catch the immunization clinics where they are going. So when they move from one place to another, they miss the immunization clinic for that place also and for the other also. So when we are using open file policy, I must suggest that there must be the policy that whenever these parents bring their children in the health facility, they must be immunized as per according to the age or according to the history they given or according to the immunization card if they carry with them. So and they must be assured that the underdose of immunization is risky for the children, not the overdose of the immunization. So we if we look at the caste religion category, so everyone had their leader for the caste and for the religious beliefs also. So if we take help of these leaders, it is possible to cover the immunization for these tribes and success of the immunization. Thank you.
Thank you, Jyoti Lande. We are aware it is early afternoon in Geneva, Switzerland, but it is already evening in India, where you are sharing your story. Thank you for joining us. We realize there are people literally from all over the world with us. Before we go to Lisa Menning from the World Health Organization to hear her feedback and comments on Jyoti's story, I just want to acknowledge a few of the people who are with us on Facebook, LinkedIn, as well as YouTube. So Tahir Umar Doom, Igor and Gang, Michael Hanley and Shedo Chukwu, Taraya, Fred and Tore, Magaji Ubaliado, Minjibir, Mariati Ramat, and Omar Casey. There are many more. I'm going to stop here to go back to Charlotte and then Lisa.
Okay, I really want to thank Jyoti for sharing her story. And yes, she's from the story we get, she's talking that two problems that come up. That's the problem of strategies to reach nomadic population that is not usually very well mastered, and then the fact that that nomadic population itself does not really master the importance of immunization services. Basically, I don't have any questions rather for Jyoti, so I could just allow Lisa to give her feedback. Thank you.
All right, Lisa, over to you.
Thank you very much. So I think that, you're totally on the right track here with this situation. And just, by way of also starting to wrap up and, offer a couple of closing remarks that could be useful for everyone is to say that it's always important to really start by listening and understanding why people might have these concerns and questions and might not be convinced about vaccination. And with the listening, it helps you to really understand why, what's the underlying issue. And as was suggested just now, it turns out that sometimes it's actually about access to services, the availability of those services, or how affordable they are and how easy or convenient it is to get to those services. Or sometimes it's about the experience with those services. Sometimes people don't feel like they're always that well treated, or they might feel like it was a bit rushed, or they had to wait too long. And health systems are not always extremely well resourced. So it means that the experience that someone has at that health centre is not always ideal. And we know we're doing the best, but we often just don't have adequate resources to focus on a fantastic experience for everyone. So all of these things in the end can lead people to feel like they were just not satisfied with the way in which they experienced vaccination. And these things can accumulate. So start by understanding, never make assumptions about the real issue that's at the heart of the problem, and then think about what you can do to have a really caring conversation that doesn't make any assumptions, that's not forceful, and really, start by asking a question like, well, what would it take you to accept vaccination? What would it take? And with opening these kinds of general open questions, that can, get people talking and make them feel like they're being heard and they're being cared for, and that will start to move them towards accepting vaccination. So, I really would just I'm going to be looking forward to seeing all of these case studies. It sounds like there's been so much energy and effort put into this initiative, and so I'm really going to look forward to taking a look to see what's there. And thank you very much to the Geneva Learning Foundation for setting up the platform and these opportunities as well. Thank you very much.
Thank you, Lisa. I do have one last question for you. Looking forward, and I know it's a sensitive question, and it's about the COVID-19 vaccine. How would you summarize what you expect with respect to vaccine hesitancy for vaccine 19 introduction? I realize that's a complex topic. Is there anything you can say at this stage already that might resonate with immunization staff who are listening in?
Yeah, it's a great question. Thanks, Rada. And so what I would say is that, I think when the time comes, when the vaccines become available, and when people have more information about what these vaccines are and what they look like and how they work, and we've seen more data from the safety studies and the trials, etc. I do think that there will be a lot of enthusiasm for people to accept and seek the COVID vaccines. COVID vaccines are going to represent a kind of return to an almost a normal life that we had before this pandemic, before COVID even existed. And so I am actually very optimistic that there's going to be a lot of support for these vaccines as and when they become available. And so, at the moment we do hear people asking concerns because we're just not at a point yet where the vaccines are fully tested and we have all the information to know about their characteristics and how they work. But once we get further down the line, and once the vaccines start being rolled out, and once WHO and other partners and authorities and governments start making available information about the vaccines and how they work, I do think that there will be a high level of demand for these vaccines, and people will have the confidence that they are safe and effective, and that really is going to help us to work towards ending this pandemic. Because, at the end of the day, we know that COVID has, taken a lot of lives and also leaves people with a lot of serious long-term side effects. So we do know that in the end, vaccination really is going to be the best way forward, and we do think that there's going to be a lot of support in the end. So yeah, I'm very enthusiastic about what this holds. Yeah, thank you very much.
Great, thank you. And again, a round of applause for our presenters today, as well as immunization staff all over the world who are going to be on the front lines once again, keeping vaccination services going during the pandemic, and who will be asked by their ministries of health to contribute to the rollout, introduction, and engagement with communities around this vaccine. Thank you. As we close this workshop, remember, for those of you who are members of a peer hub who are submitting case studies, deadline is today, and we're going to do a quick rewind and revisit the comments, mostly hellos from all over the world that we received during this event. So stay with us if you've got another couple of minutes just to enjoy who was listening in from Facebook, Twitter, YouTube, wherever you were. Thank you for having joined us, and see you soon.